Thursday again. Doesn't it come around quickly? Oh, we're not there.
We're not sure if you're there or not.
We're not sure if they're not. There's a little round blue circle going round and round. So there we are. Hello, everybody.
Hello.
Thursday again. It's Naomi Morton, one of the infant feeding midwives, and
Elisa, infant feeding midwife.
And we are today in on level 7 in the Sophie Moon room in level 7. So hopefully you can see us okay, and do let us know if you can hear us and if you can see us. I'm busy looking to see if we've got questions, but do please send us anything that you would like to talk about today, any views, any questions that are burning, any problems that you've had to do with infant feeding. This is an infant feeding session, so we're not talking about pregnancy related things unless it's about infant feeding, about feeding your baby or anything linked to feeding your baby. So if you have questions about scans or about inductions, please direct them to Ask the Midwife questions, or to some of the MLU Ask the Midwife sessions, or see your own midwives, so that you get the answers that are the most up to date, because we don't work in that area all the time, and things are changing constantly all the time about visiting and about who you can bring and where you go for your appointments. So please direct it to the people that will give you the most accurate answer. Have you got anything to add to that, Elisa?
Yeah, right.
So I'm just looking to see about our questions today and see how we're doing. But to start off with, I thought that we could just talk a little bit about breast surgery, because we do have quite a few women that have had some form of surgery in their life before they've got pregnant, and they may have had operations on their breasts for medical reasons, or they may have had breast augmentation, breast implants, or they may have had a breast reduction, or just lumpectomy, or they may have had trauma to their breasts. And all of those things could have an implication to you when it comes to breastfeeding. And it's always much nicer if you have anxieties around these things, that you have a plan in place before you have your baby, rather than getting to just after the birth and then suddenly you mention something to one of the midwives that's caring for you about your ability to breastfeed. You may find it really helpful to talk it through with somebody before you have your baby. And there's every opportunity to do that when you have your midwife appointments, when you see your midwife. But the other thing is that you can refer yourselves to the infant feeding team if you'd like to, or your midwife can refer you to the infant feeding team. And you can have a teleconference with us. And if we do have clinics running, so clinics will eventually hopefully come back. We're not sure when they're going to start yet, but we can do face-to-face. But we are doing telecontacts, and also we are doing some attend anywhere appointments online. But we can generally do antenatal attendances over the telephone, and you can just talk us through why you've had your surgery. Some people have surgery for cosmetic reasons, and that's absolutely fine, that's what you wanted to do, but your breasts grew normally. Other people have breast surgery augmentation because their breasts didn't grow at all, and that's more concerning to us, because if there isn't very much glandular tissue in your breast, then the risk is that you may well have a risk of not producing as much milk if the glandular tissue development in your breast, which is the tissue that has the prolactin receptors in your breasts to make the milk. If you've got very few of those, then the opportunity to make milk is reduced. So you need to be observed and supported very closely when you have your baby. You probably need to weigh your baby a little bit more often to make sure that there is milk transfer, and we need to just tap into you and make sure that your baby is reaching the milestones that we expect it to do. If you have had a breast reduction surgery, depending on how much you've had removed, you will have interference with your breast tissue as well, and they may have taken large amounts of breast tissue out of your breasts. They may also, depending on when you had the surgery and where you had the surgery, if it was in this country or elsewhere, they may have taken severed the nerves in your nipples completely, and that can sometimes affect the messages that get sent back to the brain, to the pituitary gland in the brain, through the fourth intercostal nerve, which sends messages to the body to make milk. And if that's been severed for any reason and you have no sensation in your nipples, then it may be more difficult to get the breasts to make milk. So you've got reduced sensation, and you will have reduced glandular tissue, and so two of those things will reduce the production of milk. Could be significantly, it might be a little bit. So I think that it's really important that you let people know that you've had surgery that are important. You don't have to tell everybody, and it doesn't have to be written everywhere if you haven't shared that information with anybody else. But it's probably prudent to talk to us before, so maybe from 34 weeks you could call us and we could put a plan in place for you, and we could hopefully see you on the ward if you're delivering in the hospital, so that we can put a plan in place with you when you've had your baby as well. So there's lots of things we can do to support you when you're breastfeeding if you've had those things done to you. So if you've got questions, do let us know. Oh, we have got questions already, lovely. So I'm going to start straight away. Beatrice says, my baby's 4 days old and I'm breastfeeding. She's feeding every 3 hours or so, and in the day, and then at night I'm lucky to get 1.5 hours between feeds. I know it's early days, but is there a way to help extend the night feeds, or is this quite normal at their age?
Okay, so Beatrice, thank you for your question, and I would say that sounds absolutely normal. Babies at this stage, you said your baby's 4 days old, so at this point they're feeding. They could feed much more frequently than that, and they're really putting in place, we say we're putting in the order for more milk to come later and to protect your milk supply long term for all the months ahead. So it's lots of feeding, just to build up your milk supply. The more your baby feeds, the more your body knows that more milk is needed and will start producing more milk, and also start securing more milk, as I already mentioned later on. Again, when we talk about feeding, making sure that you're comfortable, again, making sure that your baby's reaching the milestone, so we're talking about pees and poos every time, and so we're expecting at least a couple of poos a day. At least a 2-pound size coin, so this is the very minimum. So there could be much larger poos and much more frequent, up to after about every feed. So if your baby's doing that, and then around day 4 should be already sort of either green or going to green, between green and yellow color the poos, and wet nappies should be increasing, and by day 6 there should be at least 6 heavy wet nappies a day. So if your baby's doing all these things and you're comfortable when feeding, you can see quite a lot of glugging at this point probably, then it sounds like a very, very normal feeding. Sometimes babies feed and then, after 20 minutes, 40 minutes, they might wake up and feed again.
They love growing horns, don't they, at night? Babies all grow horns at 8 o'clock at night, and they disappear at 8 o'clock in the morning, don't they?
Night as well. Night as well is a good time where your prolactin levels are higher, so it's a good time for babies to feed a lot, so that again your body is ready to receive the information and produce even more milk. And this might happen, they'll feed a lot in the early months. Really, I don't think there's much.
They're very needy little things, and think
feed.
about puppies and kittens and how much they feed at night when they're just born, and how busy you are if you've got puppies and kittens to look after. Their mum is constantly feeding them. It's something which you should be doing at this stage, and we'd be very worried if you weren't, because it's putting the order in for 3 months' time. You're calibrating your milk supply for your successive breastfeeding, and your baby's doing a very good job by the sounds of it. It's not so good for you, but if you can sleep during the day, take your clothes off, shut the curtains, shut your phone off, get into bed, have a proper sleep, particularly if your baby's sleeping, and get your partner to do the same. You can do shifts so that you can switch off completely and you're not worrying about your baby. But you have to learn to, to snack sleep in the day, and a lot of people find that really difficult, particularly when the phone's going and it's very warm like it is at the moment. But you do have to learn to do it, because you can't do day and night duty every night. It just doesn't work like that. So look after yourself really well.
Yeah. Other things to consider as well, you can maybe look some videos online or ask your midwife, or try and find some support to try and feed maybe lying down on your bed. That sometimes can help as well, as long as it's all set up safely for yourself and for your baby, especially at night if you think you might fall asleep. You can look at some guidance at safe sort of co-sleeping and feeding during the night, both on the UNICEF website, on BASIS website, and on the Lullaby Trust website, so that you can find all the way to keep the environment safe, so that you can safely feed your baby lying down, where you could be resting a little bit more to get through the nights and the longer frequent feeds.
I hope that's helpful. Natalie says, hello Natalie, she says she can hear and see us, thank you, lovely. Felicity says, the best way to rebuild supply after an established feeding at 20 weeks. Well done. Feels like the supply has dropped baby back to cluster feeding. Should I pump after feeds?
Okay, so I mean, again, we do look, so babies do have a few growth spurts in the time, so sometimes it looks like they suddenly start feeding more frequently, and then could be normal. If instead your baby was not growing quite as expected, or is not pooing or weeing as expected, is not reaching the milestone, then there might be a sign that the milk supply had actually dropped. So it is sort of trying to figure out whether it is actually a lower milk supply, or if the situation is more than your baby's fed really well, it's still feeding really well, but it's just putting in a little bit more order in again.
Composition needs to change at about 4 months, because they
days.
start to pick things up a bit, don't they, and put their bits and pieces in their mouths, and so they're probably stepping up their order a bit more. And it's been bumming hot.
Yeah.
If you haven't noticed, we have. Your baby's probably noticed and is a bit more thirsty as well. So it sounds normal, but don't let it go on too long. If you're worried, do give someone a call just to check. But or you could just do a little bit of pumping if you felt that you were dropping your supply. But it's more likely your baby's needs are going up rather than your supply going down. Unless something like you've started your periods, sometimes that can just drop your milk supply for a little bit. Or if you've gone on to the oral contraceptive pill, make sure it's not the combined pill if you have. Sometimes it just has a bit of a waiver for a little while, and then it picks up again if you've changed some medication or something. Just double check that it's okay to be on that, and whether it's that or not. And if you're not sure, ask somebody. That's really important. So I hope that helps you, Rebecca. And Tasha says hello. Rebecca, hello. How far in advance can you prepare formula bottles? What would you advise is the best process? Do we need to bring formula to the hospital if we're planning on formula feeding? So Rebecca, no, you don't need to bring formula in. We have got formula here for you. We have got 3 brands of formula here, so if you wanted a particular brand, then you would use that when you got home. But we have Cowgate Premium, Aptamil, and SMA are the 3. So that's the standard bottles that we have here. So and it's up to you which one you would like to use. As far as making feeds in advance, you make 1 feed up as you need it, and you make the feeds once. You make 8 or however many you're making a day, but you make them one at a time. You boil the kettle to 100 degrees, and then you let it cool for about 20 to 30 minutes to about 70 degrees. You always put your water in first, and then you put your formula in on top of that as it's directed on the label with the scoops that you have in the tin. And don't underdo it or don't overdo it, just make it exactly the right dilution for your baby. And then shake it up and allow it to cool for your baby. And then you can use that for about an hour. And then after you've used it and finished with it, in that hour you throw it away. And then you make another one just before your baby's due a feed again, so that it's cooled and ready for when your baby's due a feed. You shouldn't be using it more than once, and you should be discarding it, particularly in this warm weather, after an hour. And so in the old days they used to say make up the feeds for the day and then put them in the fridge for the day, but we don't recommend that you do that anymore, just one at a time. So
yeah, I would also mention, if you want to look sort of written information about making up formula feeds safely, again you can look on the UNICEF website to have a good infographic, or you can look on the Guide to Bottle Feeding leaflet. You have a good information again on how to make formula up safely. Make sure that you do use hot water each time you make a feed, and minimum 70 degrees, and this is to kill the bacteria that will be in the formula. So in the powder, once you open the tin, it's not sterile anymore, and there can be bacteria in there, so you do want to use hot water to kill the bacteria in formula, and that will reduce the risk of tummy bugs and gut infections on your baby as well. So that is very important. If you need to go out and about, I mean, there are pre-made sometimes formula tins that you can bring with you, or cans that you can bring with you, or if you want to still use the powder when you go out and about, you can find some information on how to keep the water hot and for how long will it last hot enough if you put it in a flask. And you can look on a website that is called First Step Nutrition, and you can look there, and they have quite good information again on different type of flasks. How long will it last if it's full, how long will it last if you only have the amount that you need, and often it's better if it is full with boiling hot water, and it will last usually around half an hour, I think. But at least you can then make your feed, and hopefully it will be enough for you. Or if you have facilities where you can get hot water out and about, then you could do that.
A lot of places will support you in that. The other thing to say about tins is make sure you shake it every day, because the fat will settle to the bottom of the tin. So when you get to the bottom, it's often got slightly more fatty powdered milk in it than at the top. So shake it every day, and then you will disperse the fat evenly throughout the tin, so that you don't find that your baby gets more constipated at the bottom, and then you think that the tin is not suiting the baby and you change the brand. Actually, just sometimes you need to shake the tin a little bit every day, just to disperse the fat evenly every day, and that might help you. So any more questions, do ask your healthcare professional about if you haven't had your baby yet. When you have your baby, she'll advise you as you need to know, your midwife or your health visitor, or you can of course ring us for any questions, whether it's artificial feeding or whether you are breastfeeding. That's what we do, so we're here to support you either way. Rachel says, hi, my 10-week-old daughter has possible reflux, but sometimes coughs, gags and throws up during and after feeds. She then's not very keen to continue feeding. I try to keep her upright, and the gagging does not happen just when I get to get my let down. Any advice, greatly appreciated, thanks. So you get she coughs and splutters when you get a let down, so you've got quite a forceful let down, that sounds like. Rachel, is that right? And then if she lies down, she gets a little bit uncomfortable.
Okay, so there are a few things to consider. So one, as Naomi's mentioned, could be a forceful letdown. Another thing could be as well how your baby's attaching at the breast, meaning that sometimes they're fine, they're feeding, you're comfortable, they're growing. But still the latch is not quite optimal, and it's not quite deep enough, and what happens is that the milk can pool in their mouth, and there can be a bit more coughing and spluttering about, and they sort of struggle a bit to cope with the flow. So it would be good probably to get someone to look at your baby attaching at the breast. You can also have a look yourself online. There are some good videos like Attaching Your Baby at the Breast by Global Health Media. You can look at the positioning and attachment article from La Leche League, Great Britain, which has quite good other links to videos, to try and maybe a bit self-assess, but also get some extra support to observe the latch to make sure it is the best that can be, and that could help.
Sometimes if you've got a really forceful letdown, you can just hand express a little bit off till you've had the letdown, and that sometimes just takes the ferocity away from the first letdown, and that sometimes does help. and you might find that's a little bit easier. Are you doing laid back sitting up slightly feeding, because that sometimes can be comfy? Did you say that already? You'll keep her upright after
Upright.
feed, but sometimes you can feed her in an upright position.
Yeah.
The Obstetrical Breastfeeding Support (OBS) are back next Monday. They're back from their break, so they will be up and about doing consultations online as well as support. So and also La Leche. So they do lots of support, and also your health visitor is a good source of support. So get lots of support from your community local to you. And if you're still struggling, do contact us if you need to. We tend to concentrate on babies up to about 6 weeks, and then the health visitor team will continue the care from 6 weeks with breastfeeding. They do have supporters that will help you. But if you want to talk to us, we're very happy to talk to you on the telephone. See if that helps. It may be that the latch, as Elisa said, isn't quite deep enough. I hope that helps you a little bit. It's very frustrating, and you've done so well to get to 10 weeks. A big achievement, really big achievement. Claire, hello. My question this week is about positions for feeding older, bigger babies, your lovely big baby. Since you saw us at 6 weeks, my baby has gained 500 grams. Aren't you a star? Now 5.8 kilos at 8 weeks. Wowza. The cross cradle position really hurts my wrist. Yes, I understand that. So now you need to do big boy feeding, don't you? Do you have any suggestions for positions in which to feed our babies as they get larger? Many thanks. We've got a big boy feed.
Big boy. Lovely. I mean, one, if you are out and about and you were doing a cross cradle and you still find that one comfortable, something that you could do is to lie back a little bit more, and that might be that it will relieve the pressure from your arms, and will be the weight of your baby on your body, so you're not straining your back or your arms or your shoulders, and that might help if you both like that position. Otherwise, another good position could be, again, sort of either a sitting up position, and we were talking earlier again about babies who cough and splatter. Again, it's good as well.
We didn't like that very much, did we?
And it's worth trying again, because sometimes babies don't like it when they're smaller, or mothers don't like it when their baby are a bit smaller, but things might change. So you could try. So hold your baby under the arms. That might help you to have a little bit more control at the start. So under the arm, you have the thumbs around the chest and the rest of the fingers around the back. You can sit your baby around your leg. And again, nose to nipple, babies coming from under the nipple, and often they just latch on their own. Sometimes you might need to just help them come a little bit closer once they're opening their mouth wide. And then again, you could relax back a little bit, or bring one arm around so their head can rest in your armpit, and there you go, you get a nice comfortable latch.
It is a nice position for some, but some people's anatomy doesn't allow it very well. The other position you can do is sort of cross cradle, and if you get a bowl under your foot or something like that, you can lift your foot up so that it's stepped on a step or something, and just sit him on your lap and feed him like that on your lap. And you can do the opposite side, so you're sitting on the opposite side and you're sitting him up slightly so that he can look around, because they get very nosy, don't they, when they get to a certain age, and they want to look. So you can sit him upright in the crook of your arm and feed him like that, because they do self-attach much more easily when you're bigger, and your nipples will allow them to be a little bit more creative with their mouth on your nipples, so you don't tend to flinch when they're pulling and pushing and coming on and off and smiling at you. So you can just sit up a little bit with one of your legs and put a cushion under his bottom, so you can get a cushion and just sit him up a little bit, sitting on his bottom, and sit up feeding like that, and or have a little gap and put in between your knees, and then do a big boy feed like that, and your body will allow you to do that with your positioning and attachment that you can't do with newborn babies. You can't do this with newborn babies at all. It just doesn't work. But with bigger babies, they self-attach, and they've got big wide open mouths that are huge, especially when they're 5.8 kilos. And he may well self-attach, and he can look around, which will annoy you because he'll pull on your nipple. But that this is sort of a nice big boy position to use as well, which they quite like. So have a little try with that, Claire, and see how you get on. Hope that's helping you. Lovely to hear you're doing so well. I hope it's a good experience for you. Paige, I think Paige has contacted us before. Hi, I'm 4 weeks postpartum and my little one had a struggle with latching to begin with, but it's fine now. He only seems to stay on the breast for a maximum of 15 minutes and still seems hungry. Is this normal? I'm having to top up with formula as I can't afford a pump. My left breast seems to have it's starting to dry up also. Anything you can recommend to get it back?
Okay. Oh, sorry to hear about a bit of struggle.
Like you've been doing really well.
Yeah, but definitely, yeah. If it wasn't attaching, now it's attaching. So amazing. I'm just thinking. So there are a few places where a pump can be hired often, and there are some pumps, depending on the size of the breast and the size of the nipple, they are affordable, but some of them have sort of fixed size funnel, so it's worth, if you're not sure, you can give us a call, because there are some pumps who are quite cheap, around between 30 and 40 pounds, and probably, formula ongoing will cost you more. So we can have a chat about it. Health visitors often have pumps that you can...
OBS do.
Also share breastfeeding support again. They'll be back next Monday, so that could be a good place to go. You could in the meantime hand express if you don't have really anything available. If you feel that is something that you could do. Some mothers do quite well with hand expressing, others struggles more. So, but it is something that you could try on top of your breastfeeds. Try just and encourage your milk supply a little bit further.
Maybe do some compression when you're feeding. So make sure when you're feeding that you are, as your baby suckles, you're compressing, because that will increase the flow into your baby's mouth, and that will increase letdowns and stimulations. And also you can do a little bit of switch feeding for about 48 hours. So when your baby gets cross, take him off and put him on the opposite breast. And when he gets cross, put him back onto the other breast. And when he gets cross, go back onto that side. And do the compressions at the same time. If you do that for about 2 to 4 days, you might find that steps your supply up without pumping. It's like pumping while you're breastfeeding. And it's probably the best tool you can use as a mum when you're struggling to breastfeed, because it will do it, self-regulate and increase your milk supply. And, have you had longer, because you're giving formula, are you having longer breaks between your breastfeeds? Maybe feed a little bit more frequently in the daytime when you're able to cope a bit more, so that he steps up the stimulations a little bit, and that might increase your milk. Introducing formula will send messages to the body to not make as much milk, because he's getting more milk from a bottle from elsewhere than he is from you. So your body's naturally thinking that you don't need to make it anymore, so that will naturally reduce your milk supply. So the more you put your baby to the breast, the more you're going to make milk. And if you did have a good supply in the 2 weeks, 3 weeks, and then it's suddenly going down, it's probably that you've made enough stimulations to build that supply back up to a good supply again. So you're in that window where you can still do that. So just put your baby to the breast more frequently, or hand express, or switch and compress, and just see if you can naturally increase your milk supply without using a pump. It's not always the right thing for everybody, and it might help you. But do call if you want to go through anything more personalised, and we can help you in any other way to keep that milk supply going, because you've done such a good job already.
And it might be that you need to set aside a few days just to do that, and put aside other commitments if it's possible, of course. Other things as well that can be considered if a bit of extra milk is needed is a nursing supplementer. So having the extra milk given at the breast with a little tube. I'm not sure if we have
got one in there.
We have got one in here. So it would be having your extra milk in a bottle, and then with a little tube will go from the bottle at your breast as your baby suckles. So when they get a bit frustrated after you've done a few switches around, then you could introduce that so that the flow continues, your baby keeps suckling and feeding at the breast, and that keeps the stimulation going and might help you build your milk supply as well.
And you can give formula in those as well. Many people do give formula in those. And for any of you that are watching that may have had breast surgery, something like that is something we do use as well to support you if your supply doesn't quite get to where it should be. That's why they were created a long time ago, and we've been using them. And that's one of the things that we do use for mums that are struggling with supply if they've had any problems with lactation supply and making milk. Right, so I hope that does help you. Do come back to us if you need to. Natalie says, I don't have a question, I just wanted to say a massive thank you to Naomi and Hannah for supporting me at the JR the other week. My milk supply has now increased from 20 mils per pump to 100 mils. That is clever. And my baby has now had a tongue-tie diagnosis and has been referred to get this sorted. I appreciate all that you ladies do. Oh, you're more than welcome, and it's music to our ears to hear you've done so well. I bet you pumped for England, and that's what happens. You get your milk back, don't you? So it's hard work, but you've had a repay, and you've protected your supply while you're waiting for your baby to have its tongue improved. So do come back to us if you've got any more struggles. It'd be lovely to hear your story, Natalie. Let us know how you get on. Well done, you. Elizabeth says, hello, maybe you remember me. Yes, I do, absolutely. I gave birth to Bra, who was discharged a week ago, and you gave me some very helpful advice and left me with some frozen donor breast milk bottles to take home. That's very rare. It's a real treat to be able to do that, and we are doing it in some circumstances. It's not standard practice. My milk is not fully established. How do I go about applying for some more DBM? Thank you. I think you need to give us a ring, actually. Have a little chat with us, Elizabeth, okay? And we'll have a talk through with what's going on. If you don't mind, we'd love to hear from you. Paige has replied to us. He's also finding it hard to latch back on if he lets go for a second and gets very upset if he can't get back on. So Paige, you were having trouble, weren't you, with the let down, I think. He was hungry and on for 15 minutes, wasn't he? So I think that goes along with supply, that he's not getting what he wants. And the more bottles you give, the more flow confused they get, because babies are very flow driven. And when the flow slows down, they get cross because it's not like the bottle that they've got used to, where they get lots of milk the same speed all the way through. And the breast doesn't deliver milk like that over a period of time. So as the breastfeed goes on, the supply slows down. That's where your compressions will come in, and that's where switching will help, because you will keep that flow much greater if you're compressing and pushing. So compressing is holding and not pumping. So you're not doing that. You're holding and you're squeezing and staying squeezing until they stop suckling, and then you let go and then you start again. So that's really important, that you give that flow an extra boost. And also, if you compress and switch and you go to the other breast, there'll be more milk in there. Your breasts are like kidneys. They never stop filling up. They never empty. They drain, but they never empty. So as soon as you stop using that side, it will start to fill again. And then when your baby goes back to that side and back to that side, there will always be mouthfuls of milk. So they feed much more nutritively if you allow them to suckle and switch. And compress, because you're pushing milk in and they're getting a fresh breast every few minutes. And that sometimes just makes them suckle for longer, and it ups the supply. And then, 48 hours to 4 days, you see your supply going up. So I think the problem that you're getting is that he's getting cross with the flow, and that's why he won't go back on. Talk to us if you need to. Erica, hello, no questions, but want to say a massive thank you. Oh, we've done that one. Or was that someone? No, that's someone else, wasn't it? Yes, Erica. So we've had 2 massive thank yous. That's so lovely. To Naomi and Hannah, who's supporting me. Thanks to Hannah. We now have high palate and tongue tie. We know we've got a high palate and tongue tie waiting for surgery, and then we'll see you ladies again. Many thanks for what you're doing. Well done, Erica. That's amazing. You've got the answer, and hopefully we'll sort out your problem. Elizabeth comes back. Also, any tips on how to get baby's tongue down? The biggest struggle is getting her tongue in the right position. Yes, I think if you get a little syringe or a spoon, or you get your bottle of milk, if you've got any access to donor breast milk or not donor breast milk, express breast milk, tip it all over your nipple while your baby's feeding, and they'll start to lick. If you get lots and lots of milk dripping all over your breast, they will start to open their mouth and lick. And when they do that, their tongue comes down, and then that will help him attach. So give him a present while you're trying to attach him, and he'll start to lick and open his mouth before he feeds, and that will make his tongue come down. Try that and see if it helps, Elizabeth. It's a little trick, isn't it?
If that is not quite working as well, sometimes some babies might do it if you do a little finger feed. So if you let them suckle on if you wash your hands, have your hands clean, and put your finger in your mouth with the soft part on the top, so towards the roof of the mouth, and you can let them suckle a little bit on your fingers whilst they're already quite close to your breast, and then you could do that for a few minutes, even for under a minute sometimes, and then try to attach straight after that. That sometimes helps just bring the tongue down a little bit just before the feed. Doesn't
really
work for all
frustrating when they
babies.
do it.
Works for some babies, not all of them, but it's worth trying.
Certainly, covering them with milk often makes it easier.
Yeah, that's
it does make them lick and lap, and then they start to open their mouth, and you can get them to do that, and they realise then that they want food. So it might help you. It's frustrating though. Laura says, "Hi, I'm 38 plus 1. I'm starting to have some success with colostrum harvesting. Fabulous. I've managed to get 1.5 syringes worth over 2 separate occasions. Wow, aren't you clever? That's amazing. However, I've noticed that only started to express once. I moved where I compressed much closer to the nipple than where I was seen being demonstrated by your team and others, and have to press harder than I thought had been doing previously when I just got a glisten. Does it sound like I'm doing it right? I'm worried it could be doing damage since I'm not pressing the breast in such, but rather nearer the nipple."
Breasts are all shapes and sizes. Some will need to be a bit further away from the nipple. We do say usually about 2 to 3 centimeters, but some others need to go much closer to the nipple. It's trying and finding the right spot really, because everyone will feel different and will have spots where it will work better that for others will not work. So it's good that you're exploring, you're having some time now to explore and try and find the right spots on your breast. Often mothers do say that they feel like they need to press a little bit harder than they think, so you're probably doing it right. Make sure that you are still comfortable so that you're not sore or in pain when you do that. In that case, probably change spot, or try a different type of compression, or press a bit less. What else?
Experimental.
Yeah, experiment and try. It might be different from what is demonstrated. It's not always by the book, and as I said, all shapes and sizes, and it's about finding what works for you really. And if you have time to do it before your baby's born, then you know what to do once your baby's born. Also, sometimes mothers find that during pregnancy something works, and afterwards they need to change a little bit the spot of the pressure or the way they were compressing their breast. So, but this gives you at least a bit of time to explore and try different things, and you'll be used to doing it. So once your baby's born, if you will need to express again, then you will know roughly, what things to try. And
isn't it exhausting for your fingers when you start doing it? Most people find it so hard. They say their hands ache, because it is really hard to do when you first start doing it. It does make it, it is quite hard work. So it sounds like you're doing an amazing job.
Yeah.
What a lot of colostrum you've managed to get out, which is fabulous. Well done.
And also I would say you were worried about trauma, so I would say make sure that you're not sort of sliding your fingers or pulling your nipple forward. So you're just, I'm not sure if you can see, so you're just compressing for a few seconds, 4 to 5 seconds, and then releasing, rather than sort of sliding the fingers or pulling, because that might cause a bit of trauma. You might feel a bit bruised if you keep sliding and rubbing. So it's just a compression.
Beatrice says thank you. Hello Julie, you're watching. Lovely to see you've tuned in. So that Felicity also says thank you both. Rebecca says thank you. Rachel says she was talking about the letdown, and we were saying about doing a bit of stimulation before. She said it's often at reattachment, so it's not the first letdown. It's when you get lots and lots of letdowns when you're breastfeeding. It's often at the reattachment.
The reattachment is the coughing and spluttering
Yes.
there.
So it may be that he's not quite far enough on, and the milk is pooling at the back of his throat, and you're getting another letdown, and it's just catching him in the throat.
I mean, it might be. I mean, it depends. Maybe keep an eye. Is it more on one side than the other? Sometimes one breast produces more milk than the other, or sometimes it's just a different shape. So the latch works perfectly well on one side, and when you then switch to the other side, it doesn't work quite as well. And it's just because the shape of the breast may be a little bit different. So how your baby's attaching there doesn't work quite well. Also, maybe try considering just see if your baby needs winding or burping in between. You know, sometimes if they're not quite ready, they might splatter. Although if this is more frequent and you're doing that already, that's likely to be a different reason.
I mean, the other thing you could try is just tweaking the nipple up a little bit when you put your baby on, just to see if it just puts the nipple higher up into the palate. If your baby's got a slightly arched palate, sometimes it just creates a much better vacuum, and that allows the milk removal to be a little bit more efficient. So maybe just tweak the nipple up a little bit, and your baby will get itself right underneath, and the nipple will skim over and go to the top of the roof of the mouth, and that just might make a better seal, which makes the transfer of milk better, as your breast has got a bit softer when he started to feed, and that might just make a better seal, so that you're if it's softer there than it was when he first starts, where they get a really firm mouthful of breast. It might be that you need to work a little bit on just making sure the vacuum inside the mouth is better, as best that it can be, and sometimes just tweaking the nipple up sometimes helps that, or even making a sandwich with your fingers, and that creates quite firm breast, and sometimes that makes them feel a little bit more secure on the breast when you're feeding, and just keep your fingers there for a few minutes while he's suckling. And that does sometimes help them if they're struggling with a softer piece of breast in their mouth, where they've had a big mouthful of harder breast. It sometimes just gives them that firmness that they got at the beginning of the feed that they like. Have a try and see if that helps. It might make a difference, it might not. And talk to us about your experiences so that you're not struggling. All of this has got to be enjoyable.
Yeah. And the other thing might be actually if you have hand expressed a little bit just before feeding on one side, trying to again hand express a little bit. If you're switching side, hand express a little bit again before reattaching to the other side. As letdowns happen quite together, it might be that as you reattach, there is quite a lot of milk ready there. So maybe hand expressing again a little bit just before reattaching your baby to the other side might help.
It's all very experimental breastfeeding. It's very individualised. So do call us if you've got any issues that you want to go through personally. If you're just not sure, or ring OBS or La Leche, because they will be able to advise you as well. On just more personal to you, we can answer much more personally one-to-one if we need to. Hope that helps you. I know it's really frustrating. Kay's watching us. Hello, Kay Edwards, lovely. Laura, if I may please ask a second question. Of course you may. I have hypothyroidism, which has been well managed through pregnancy, and I'm on a relatively low dose of levothyroxine. I think it was mentioned on last week's session that hypothyroidism can interfere with milk supply. Do you have any advice how I can best mitigate this once the baby arrives? Yes, you're absolutely right. We did mention that last week, and yes, people that have got thyroid function problems do have a slightly lower risk of making slightly less milk. Not everybody. Some people have no problems, but it's part of the endocrine response and the response to dopamine in the pituitary gland, and so it can interfere with the production of prolactin, which is why we really talk about it. So it's really important that you do lots and lots and lots of stimulation when your baby's born, so that you maximise your chances of producing milk. So you start with really, really prolonged skin to skin if you can, and that includes, if you have a cesarean, do as much skin to skin if you can, with a feed as soon as you can get your baby attached, certainly within the first hour if you possibly can. your baby doesn't attach in the first hour, then you should be hand expressing in the first hour. This is everybody, it's the same information for everybody, but if you want to absolutely secure your supply, get on it. Hand express as much as you can in the first 2 or 3 days, and then if your baby's not attaching frequently, do that for him by hand expressing, so that you're really putting the order in for your milk. And also, when you have had your baby, will you ask for a referral to the infant feeding team, so that we can come and put a plan in place for you, because we do see women on the wards that have got exactly as you have, or anyone's got any medical problems that would interfere with breastfeeding, if they've had any chest or breast surgery, anything that could affect the baby. We will see. We don't tend to see mums with routine issues with positional attachment, because your midwives on the wards are perfectly able to help you with positional attachment and feeding and how to hand express. But we will see much more complex things and support, and we will advise the staff if they have any issues where they're not quite sure that it's within the normal, so you're within the normal. But if you have got medical problems, we tend to put a plan in place with you and just make sure that everything is okay and support you if we can. So not everybody will get the chance to have a consultation with us, but we are happy to advise and we are happy to support the midwives on the ward. But certainly if you have got hypothyroidism, then it's a good idea that we have a conversation with you at some point as an inpatient if we can. So I hope that helps you, and be reassured that you will probably make a full supply, but we're here to support you if you fall a little bit behind. I hope that helps. Have you got anything to add to that?
Yeah, I think the only other thing, probably familiarizing yourself. I mean, this could be again for everybody.
Absolutely.
But if you have any condition that sort of puts you at a slightly higher risk of having low milk supply, potentially, is maybe familiarize yourself with the signs, how to know that your baby's getting enough milk. Again, we showed this last time, and it's Off to the Best Start leaflet. You can find it online, and they have on page 17, how do I know that my baby's getting enough milk? So again, we're talking about poos and wheeze, and then weight gain. So maybe get familiar with it, so that if you then go home and you find there is any sign that your baby might not be getting quite enough milk, you can get help timely, and you can get support early through milk supply, so that you can.
We talk about the 4 reliable signs of milk transfer. Yeah. We say this a lot, don't we? So the first sign of good milk transfer is your baby's suckling and swallowing. So you will see your baby's jaw moving really well, and there's lots of videos on YouTube that you can see where it shows a baby glugging at the breast, and you can see that a baby is transferring milk if you're not sure. So big deep glugs with their chin, and you can see that their eyes are open when they first go on, and they're getting lots of milk. Their eyebrows are going up because the milk is pouring in, and you hear them swallowing. So some will hear babies squeaking as the milk's going in because there's so much, and others won't be quite sure, particularly in the early days when there's not the volume in your breast that you get before your milk comes in. But what you will hear is your baby sort of when it's swallowing, and that's your baby's swallowing signs. So you want to be seeing that suckling movement, and you want to hear that swallowing. It's really important that you can hear that. That's the first reliable sign that your baby's taking milk in. Now, if your baby is under 37 weeks, they look like they're doing that sometimes, but they don't feed very reliably. So if you have got a premature baby, we would always suggest that you gave your baby extra food after it's had a feed, until you're sure that it can do that, and you need to be supervised with, or put a plan in place with your midwife if your baby is premature while we're doing this, because it's not reliable. But in a baby over 37 weeks, if it's suckling and swallowing well like that, we would expect that that's a reliable sign. And then the next sign is that your baby's peeing. So depending on how old your baby is, it's 1 pee a day on day 0 and day 1, 2 on 2, etc. And you get up to about day 5, then they should be doing about 6 wheeze a day. And if they're not doing 6 wheeze a day, then you need to be talking to somebody. And you do see your midwife on day 5 anyway, but you shouldn't have any brick dust, any sort of orangey deposits in the baby's nappy on 5 to day 4. So tell the midwife if you've seen orangey deposits and your baby's over day 4 in your nappy. And if you're not sure whether your baby's doing enough wee, then put a couple of tablespoons of water in a nappy and feel what it feels like, because that's about the right weight for your baby, and you can do that at home, and you can tell if your baby's peeing enough then. And have a look at it. Does it look concentrated? Does it smell strong? And then you look at poo. So the third sign is poo, and as Elisa showed you the picture of poos, it's sticky like Marmite on the first day where it's hard to rub off, and then after day 1, when the poo starts to come a bit more and the colostrum's got through the gut, it starts to get less sticky, but it's dark, it's like blacky brown colour. Then it starts to go much more greeny brown, and then by day 5 it should be yellow, and it should be bright yellow, and it should be bitty. The nappy should be very obviously changed colour, and we know that the milk has got through to your baby's gut. And the sooner they do that, the sooner they get less jaundiced and they start to feed more effectively. So if you've got sort of meconium sitting in your baby's gut, it's much more likely to stay jaundiced for longer. So the more colostrum you give your baby in the early days, the more they'll poo, because colostrum is a laxative, and they'll get rid of everything, and then they'll start to have a changing poo. If your baby hasn't pooed on day 3, you need to be calling your midwife, because babies should poo every day. And if it doesn't poo on day 3 or day 4, the chances are that it will have more weight loss on day 5. So if you call them before that, you can start doing things earlier and stop the excessive weight losses that we sometimes see, where your baby sometimes has to come back into hospital. So be really proactive as parents. Look at the suckling and swallowing, look at the wees, look at what's in the nappy, and act on what you're seeing before it gets, before you wait for somebody to ask you. Be really proactive. If everything sounds fine and you've made a call, it doesn't matter. But if you don't call and it does matter, then it takes longer to build that weight back up and to get that supply back going. So the sooner you let us know if it doesn't feel right to you, the better you can act, and the quicker you can get your baby feeding again. And the very last sign, the 4th sign, is weight. But if your baby's doing the first 3, so suckling, swallowing, peeing and pooing, the chances are that the weight gain is going to be fine, and you don't really need a pair of scales. And you don't have scales at home as parents, because those 3 signs are going to reassure you. And for all the reasons we've just said, if it's not happening, you phone us and let us know. And then you're taking charge of that. The baby shouldn't be losing weight after day 5. We should always be gaining weight. So 20 to 30 grams a day, and that should happen until your baby's about 4 months old. So we don't weigh babies every day, but we look at it over a week or over 2 weeks and see what the average is, and that will let us know that your baby's doing okay. But look at the other 3 reliable signs, because they are really important, and they are for you as parents to see and to make decisions about, not for waiting for somebody to ask you and say, has your baby done this? If it hasn't done it, you do something about it. You're the one living with your baby 24 hours a day, and you can call us and you can ask us those questions, and if it's all okay, it doesn't matter, but if it isn't, we can sort you out. And that's really important, that it stops you coming back to see us again, which, although we do love seeing you, we don't need to see you if you do all of the right things. So, really look at what's going on and read the information and see whether it makes sense. And in your care plan, have you got a copy of the care plan? There's also a chart that you have that the midwife will also fill in, and that has also got the same 4 reliable signs, and you may well look at your chart and say, oh yes, I've seen that.
So this is the care plan, and this is on pages 10 and 11 in your care plan. So you have a breastfeeding checklist for the first 3 days, 0 to 72 hours, and then after 72 hours old.
So, that will tell you that your baby is getting enough milk by ticking those boxes, and your midwife will do it. But it also is for you, this care plan. It's full of very, very useful information, and it took us ages to compile it all and get it into the right format for everybody. So, it does have bits in it, says congratulations on the birth of your baby, and you've got little bits that you can fill in poos and wees and feeds if you can't remember. and it's got tips on at the back that you get a sheet on that will, at this bit here, that will tell you about what your baby should be doing if you haven't seen it anywhere else by now. So, you know, you've got lots and lots of information, and also we have got a website, John Radcliffe has a website, and they've got a maternity website which has got an infant feeding page on it. So you can go to the maternity website and get other information, and electronically the Off to a Best Start is also available on that. So this leaflet is also available electronically on the website with some other information and links. So you know, use the services available to you, because it says you're looking for a start. You know, it's all available for you to click onto, and you might find some of the information helpful. So do give us a call back, Laura, if you've got any questions you want to go through, but certainly when you've had your baby, you can ask to see us and we can put a plan in place with you if that's okay. Jessica, a question about feeding overnight. My 6-week-old baby barely sleeps between 12 and 6, that's tough, but often falls asleep within 30 seconds of latching. Should I wake him up fully to feed or let him doze? This means he wants feeding about every 45 minutes. Oh, you're tired.
All right, so we can look again at what's happening in the bigger picture. It's often normal, so some babies will have periods where they're feeding a lot and very frequently. We call it cluster feeding, and for some babies it is overnight, which is often very tiring for parents. If there is a chance, then try and catch up maybe with some sleep, as Naomi's mentioned earlier, during the day. You can, and again, you know, we'll be putting up again supply. You did mention your baby is about 6 weeks, so it could be a time, you know, is it something that your baby has always done? Is it something that your baby has just started doing? And it could be again that it's putting another order in to sort of maintain and protect your supply and keep going for longer. So
is your baby reaching its milestones?
Yeah,
you know, is it doing weights normally and pees and poos? Is it happy during the day? Does it feed well during the day? Your baby, you know, is there any problem with latching in the daytime? You know, at 6 weeks, it's where your supply is establishing properly, and your baby is starting to recognise day and night a little bit more. But you know, maybe your baby doesn't know what it wants in the middle of the night. It's still sleeping, but we'll definitely need milk feeds at night still if he's waking or she is waking. So is your attachment correct? Are you doing lots of skin to skin? I'm absolutely certain you're going to throw something at the computer now that you're listening to me say that, because I'm sure you've walked corridors and been up and down and done all of those things. I got woken up by a baby in the street the other night, and I thought, oh, poor parents, they're desperate. They've gone out for a walk in the middle of the night because they're so, you know, the baby's so chatty. So, you know, it is a really frustrating thing. I think, you know, we can't really answer it just on those few lines, but if you want to talk something through with us, or your health visitor do that, we can, you know, someone can talk you through it on the phone, or, you know, Oxford Breastfeeding Support or La Leche, all of those services can support you and ask a few more questions so that we can, you know, look through everything and unpick and see the bigger picture of what's happening, so that it's much, you know, we want it to be a pleasant experience for you. So Jessica, do contact somebody to support you on that one, because you can't do that every night. It's exhausting.
Also, you know, and babies do breastfeed for different reasons, and it's been hot again the last few days, so, you know, it's looking again at the bigger picture, we said, and I've mentioned that before. Again, you can look at safe ways to feed your baby, potentially in the bed where you're lying down, or, you know, to do it safely on the UNICEF website, BASIS website, and the Lullaby Trust, so that you can find ways to cope through those busy nights and busy feeds.
It's really hard work. Well done. Keep going. It'll pass, but that doesn't help you today. So, you know, do talk to somebody just to normalise it, and have you got a group of mums that you are talking with, because that's something else that mums in this COVID situation are missing out on, really importantly, the network of mums that have, that you normally have interaction with. And certainly OBS has been doing online infant feeding, not infant feeding, postnatal group sessions where you can have a chat with other mums, not necessarily with a specialist breastfeeding there, but they're there if you want to chat, but actually just to talk to each other, and actually, talking to other mums, it normalises it a little bit. And other mums will be a little bit further ahead than you, and they'll say, actually, my baby did that for this, and it got better again. It's a trying time, but don't just sit alone and not talk to somebody, because it's really difficult to be sure that everything is okay. So do talk to someone. I hope that helps you. Delana, you've called, you're 39 weeks pregnant and you want to start labour. And how can you speed it up? You're very hot, I should think, in this weather, and your feet are very swollen. I'm hoping that your pregnancy is normal and that your swollen feet are normal for you. And if they're not, then you need to be talking to your midwife. This is an infant feeding session, so we're talking about feeding your baby in this session today. So if you are worried about your pregnancy at all, or starting your labour, then direct your questions to your midwife if you can. Your baby will come when it's ready. 39 weeks is not quite there. Some babies come earlier, some babies come a bit later than that. So hopefully it'll be fairly soon. But if you are very, very puffy, or you haven't been that swollen, then I'm sure it's just the hot weather. But do have a conversation with a midwife that's caring for you, just to check in with her. And I hope you get to see your baby very soon. Paige says thank you. Laura is replying, thank you, that's reassuring. I'm not in pain at all, so that's good. It does take a good while to collect that much, so that's your hand expressing, isn't it? So you're doing such a good job. You'll be an expert when you come to needing it, so you'll have that wonderful experience.
And also the milk flows in different ways during pregnancy and after your baby's born, especially because hormones are different. Your placenta will be at the moment producing some hormones that sort of keep your milk production at a certain limit, so that your breasts don't fill up. And once after your baby's born, once the placenta is born as well, is delivered, then your body will be ready to produce more. So the more your baby will feed, or the more you will hand express later, the easier it will become to get milk with hand expressing or then pumping, or for your baby to feed.
And Delana's come back saying, will nipple stimulation helpful? Yes, it might well be if you're right, if you're ready to go and you're a bit niggly, then sometimes hand expression will tip you in the right direction, which is why we say don't do it before 37 weeks. So it may well start you having more tightenings and go into labour, but only if your body's ready to. It's not going to bring it on necessarily, but it might do if you're very ripe and you're just about to start labour, or you're niggling already. It's not going to do any harm now at 39 weeks if you do hand expressing. It will give you a skill, and it might start you labouring. So go for it, I would say. And talk to us if you've got any other questions, or talk to your midwife about that. And hopefully we'll see you with the baby on the other side. All right. Imi says, I'm on the postnatal ward as we speak, and baby was born yesterday at 7:20. How many times should he be feeding?
Yesterday,
7:20, so he's just over 24 hours old, isn't he?
Yeah, so usually in the first 24 hours, sometimes babies are a bit sleepier and they might have fed only 3 or 4 times in the first 24 hours. After that, usually they should increase their feeding quite rapidly, and usually from over the next 24 hours and going forward, a minimum usually about 8 times in the 24 hours, but more often babies feed even more frequently than that, sort of 8 to 14 times a day. So you should be expecting your baby to wake up quite frequently. Maybe tonight will be quite a tough night, where your baby will be awake and feed the whole night. And this is normal, this is common, will be your baby trying to get more milk in for you. So yeah, if your baby appears to be very sleepy or not wake up for feeds, then you might need to be a bit more proactive and sort of encourage your baby, do lots of skin to skin, do some hand expressing so that you can offer a bit of your colostrum to your baby to see if that helps to wake up a little bit and attach to the breast and feed. So yes, keep an eye. If your baby's waking up a lot, that's normal. If it's not, then as I said, be proactive, encourage your baby to feed, keep your baby close. Don't miss try and catch those little cues. So if your baby even just starts moving a little bit, opening their eyes a little bit, or start suckling the hands, or anything, do any sounds, those are all good times to try and feed your baby. So try not to miss those little, good little windows. So if you keep your baby close, especially skin to skin, that it will be easier to catch those cues and try. And ask for lots of help.
Ask the midwives while you've got them, okay? Because it's harder to access them once you go home. So ask lots of questions from your carers on the ward, okay? Laura says, thank you. I'm hoping to deliver on the spot. I'm looking at the time and we're well over here. Sharon's watching. Jessica says he's just a nightmare at night, so talk to somebody. And you've got a question there. It's the last question. I would ask if you would like to ring us. I haven't got time to talk about that now, but if you would like to ring us on the telephone, have a conversation with us at some point, that's 01865 572 953. The details should be on 950. Sorry, had a moment there. 950 01865 572 950, and direct the question to us. We can answer your question because it's a little bit longer than a couple of seconds answer. So I think that's all of our questions, and thank you so much for them. We've had lots and lots and lots today. It's been great. And I hope that we've answered questions that everybody wanted, they got the right answers and that they found it helpful. And we'll be back, well, I won't be, I'm on holiday next week. So it'll be a new face next week, not a new one, but a different face next week. And I may well be back the week after. So I hope you all have a good week, and do come and join us again next week with your questions. It's been really lovely talking to you again. Okay, so have a good week. Thank you very much.
Take care.
Bye now.
Bye.